you weed yourself? Cause if you do, we can help you slightly. Hi, I'm hand model Tanya Hennessy, and welcome to another episode of The Awkward Ask.
Hi, I'm Linh, your Priceline Pharmacist, and today we're going to be talking about all things incontinence.
Let's go first of all, what is incontinence? Because I think a lot of people will go, I know what that is, but they're like, that's like a brand of car, right? It's actually when
You lose control of your bladder and or bowel. And it's involuntary, so you have no control over it.
I think it's quite common. Am I wrong? Am I right?
1 in 4 Australians have incontinence.
Normalize accidentally peeing yourself.
Absolutely, and I'm definitely all for that. There's a lot of categories. You can break it down a little bit more than just weeing yourself.
Of course.
Yeah. But what a lot of people have is stress incontinence, which is when you laugh, you sneeze, you cough.
The sneeze.
You can tinkle.
Yeah.
And it's A-OK. So urge incontinence, when you have this strong urge and need to pee, and it's those people who actually are mostly affected.
So they need to, but can't necessarily go, or is it just they
just need to, and it's instant.
I've seen that before.
Yeah.
You know, people are sitting normally, they're like, I need to go immediately.
Yeah.
And you're like, go.
That's it. So then there's also the nocturnal one, so where you wake up frequently in the night to go to the bathroom, which can be annoying, especially for those who can't sleep.
Right.
Yep, and then you've got urinary retention, which is that feeling that you haven't emptied your bladder completely. So you go, but it's only a little bit, and you feel like the bladder's still there, kind of like that symptom when you have
a UTI.
Yep.
The worst.
So you're frequently visiting the toilet.
And then kids have it as well with bedwetting, I guess, and adults probably with the bed as well.
Yeah, absolutely. And the other thing also is that people think that urinary incontinence is only for old people, but it's actually not the case at all. So 50% of women with incontinence are under the age of 50.
That makes sense to me. The thing
Mind
is,
blown.
I feel like people just feel, and that's the reason for this series, they just feel so uncomfortable talking about it. It's so normal. We're human beings. We're meant to have things come out of us, I don't know, it's gonna happen. And one of the reasons I have incontinence is because I laugh really hard, and that just means I'm like loving life.
That's it.
And people get it because they sneeze. So here's the question. Do people who are pregnant have issues with incontinence?
Yeah, definitely. So physically as well, as the baby grows, the pressure on the bladder, and that's why they probably wake up in the middle of the night to pee a few more times than normal.
Because the baby's just pushing on that bladder.
Yeah, absolutely. Yep. So pushing on the bladder is one, but also that pressure when you deliver
of course.
The baby. So stats actually say that 1 in 3 women after having a child will experience urinary incontinence to some degree. Yeah. So in terms of treatment, there's no treatment that we can kind of offer within a pharmacy setting, of course. We'd refer you to a doctor or a GP. But we can help you with management so that you can get back to some sort of normalcy. Our management, it looks at things like pads, urinary pads, liners. We've got briefs for nighttime.
Girl, a brief is not a bad idea.
I don't think so. And it's discreet. So you wear it under your pants and no one can tell. So they've designed it that way. You can wear them at nighttime so you don't feel uncomfortable sleeping. Then there's also things like deodorants and deodorizers to help freshen up the area. We want to go with the ones that, obviously scientifically tested and designed for that area. You don't want to just use and spritz with anything. Exactly. You don't want to irritate the area. But things like that will give you that confidence to go out and to enjoy life.
So we've talked about pads and briefs for incontinence. What about, is there anything that you can do? Oh, a Kegel. Yes.
Highly recommend Kegel exercises, pelvic floor exercises, to strengthen the muscle, to help minimize the symptoms and help even, especially for women who have recently given birth or pregnancy, just because of the pressure.
Oh yeah.
And pregnancy can cause constipation, which again can lead to or can contribute to urinary incontinence. So post-birth, it's recommended that you do your Kegel exercises just to tighten up.
Also, it's just something to do with you when you're bored. You're watching Netflix and you go, you know what I mean? I'm doing them now.
So am I.
Are you?
I am.
Let's look at each other in Kegel. Oh, it's gross.
Something else which also helps is incorporating healthy food, keeping hydrated. And you'd think that because I'm weeing myself, I should limit my water intake.
Yeah, I was gonna say that.
No. So continue drinking the water. The only time that I would say maybe cut back on the water would be right before bed. Yeah.
That's where I go wrong. Yeah. Before bed I go, oof, I might be running a marathon. I think I'll drink 20 litres. Every night, Lynn.
But throughout the day, I would definitely recommend just continue to drink as much water as you can. Good healthy diet, good balanced diet, exercises. So along with your Kegel exercises, things like Pilates or even yoga, just to help with the core, I think would benefit as well.
So some people might be like, hey, I keep peeing myself. Is it because I have a wide set vagina? Like a loose vagine?
No, definitely not. So the urinary incontinence is the control of the bladder, which is a bit further up. And it doesn't have to do with the physical size of your vagina.
There's something really nice about you saying vagina. Yeah, thank you. The eye contact was necessary. So when people go to a pharmacist and they're experiencing this, what's the best way for them to communicate to you what they need or what they have?
Yeah, absolutely. So I would recommend, if it's something that you're concerned about and worried about, approach your pharmacist and ask to speak to them in a private area. Okay, we've got clinics that we can take you to and we can talk it through. So, approach us and be comfortable with possibly bringing up a lot of uncomfortable words.
You have to.
Peeing, pooping,
yes.
weeing.
You guys have heard it a zillion times.
Yeah.
And you want to help.
And it's most likely that we experience it ourselves.
That's the thing, isn't it? It's not like you're some
robot
who's never had any of these conditions. It's not like you're not a parent. You're a parent. You understand exactly what it's like.
Yep.
So these questions are just necessary. Otherwise, it's an uncomfortable, messy scenario to be dealing with if it's not managed.
Yeah, absolutely. And it doesn't have to be, is what the message is.
So that is our episode on urinary incontinence, full on. But we'll be back next week with another episode of The Awkward Ask. I love this series. It's about destigmatizing everything that you might feel is uncomfortable and awkward to ask. You gotta ask the question so you get better. Okay, bye. Love you. Sexy.